So RAANLINE et al. Very beautifully classified the types and source of pain into 3 types: acute procedural pain, that is acute episodic and acute recurrent; acute prolonged pain including a postoperative pain, that is prolonged and persistent; and chronic pain, that is most common. Now the facial expression newborn produces whenever experiences pain is very characteristic. The forehead has a bulge between the brows including a vertical furrows, the cheeks are raised, the nose becomes broadened, the mouth becomes more squarish, nasolabial floor is deepened, eyes tightly closed and brows lowered and drawn together. This is the classical facial expression used in lot of pain scales for the manifestation of neonatal pain. Now having an idea of the dimensions, the items, domains will help you to understand better the different pain tools. So infant pain measures are often classified broadly into unidimensional and multidimensional. Unidimensional is again a single item, a single domain and single dimension. So I want you to make it very clear what is the difference between item, domain and dimension. Item is just a change in heart rate, a single item. Change in heart rate alone is a single item unidimensional pain tool. Second is single domain. For example, facial expression, just now we saw brow bulge is one thing, nasolabial furrow is one thing, the squarish mouth, all are different types of facial expression. There is more number of items, but the same domain, that is a facial expression. So the facial expression is a domain which has got lot of items. So any pain tool using a facial expression will be called as a single domain, multiple item, unidimensional. Multiple domains with items of different domains within the same dimension. For example, movements, body movements and facial expression are both considered as behavior. Come to that different pain tools, we will talking about autonomic symptoms, we will talk about behavioral symptoms. In behavior, movement and facial expression together considered under one domain, one dimension. So it is multiple domain, that is tool includes facial expression, tool includes general movements. It is a multiple domain within the same dimension of behavior. So that is called multiple domain, same dimension, unidimensional measure. So if you want to divide broadly, it is unidimensional and multidimensional. In the unidimensional, it can be a single item, that is heart rate alone, single domain, that is a facial expression alone, which can include different types of facial expression components, and including a facial expression with general body movements, both are considered a single dimension of behavior. It is called as multiple domain. So having clarified the unidimensional measures, now we move to the multidimensional measures, which is often referred as composite, including items for more than one dimension. The 3 dimensions usually are including are behavioral, physiological reactions and state, includes sleep. So behavioral includes facial expression and movements, physiological reactions, all heart rate, everything. Infant factors include sleep and state. So the 3 dimension triangle is behavior, physiological reaction and state. When the pain scale contains 2 or more from these 3, it is multidimensional. Some studies suggest that behavioral items have great effect, particularly influence the overall pain assessment tool more than the physiological component when combined in the same instrument. That is the reason some weightage should be given to behavioral components more than the other items.